My name is Mrs. Fathima, Assistant Professor in the Department of Pharmacy Practice at Yenepoya Pharmacy College and Research Center, Yenepoya deemed to be University. Today my topic would be patient counseling, which is a major aspect which a healthcare professional should be adapting while counseling a patient. So today we will be going through all the concepts related to it. So these are the concepts which we will be covering today for this session. That would be definitions, introduction, essential skills and barriers, process of the patient counseling, what are the steps involved, as well as some of the examples of principles of patient counseling. So moving on to the definition, what is patient counseling? What do we know about patient counseling? So as you know, it is a process. So counseling is something educating a patient or an individual. So information or support and guidance to the patients regarding their health, medications as well as their treatment plans is essential. Why is it essential? Because it enhances the ability of a patient to solve any problems related to their health, as well as to improve or maintain their quality of health and life. And as I said, it is the major duties any healthcare professional should be adapting, just like a clinical pharmacist. So what is the main aim of it? It aims to empower patients to make informed decisions about their health, which will be compromising because of disease conditions or because of any kind of side effects or disabilities. So what benefits do you get, or why do you require to do a patient counseling? It enhances patient counseling or patient's understanding of their condition, that is, as I said, about their disease, illness or any kind of disability if they have, and also what treatment plan is being given to them, why that treatment plan is being done, and improves adherence to medication and treatment plans. So adherence is something which most of the individuals or most of the patients fail to accomplish. Adherence is failing to complete the course of a treatment which will result in no output or no outcome of the therapy, and that will not be providing any benefit from the treatment or the medications they are taking. And what is the next main important aspect? That is, it builds relationship between a healthcare professional as well as the patients. If you discuss or if you take decisions by including the patients while deciding what treatment or what medicine to be given for their disease as well as for their health condition, the patients will be able to understand about their disease, as well as they will know when that particular medicine has to be taken, why it has to be taken, and for how long it has to be taken. So they will be focused in a positive attitude, and with a positive behavior they would be able to compliance to the therapy, as well as they will be able to accomplish the treatment plan. So as we discussed in the previous slide, that is to educate patients about their health, that is the main objective of patient counseling, to address patient concerns and any misconceptions related to their therapy, and to promote shared decision making, that is by shared decision between a healthcare provider and a patient, and reduced any incidence of adverse drug effects and unnecessary health cost. As I mentioned, some of the times patients fail to accomplish their treatment, or they may not be taking it completely. They might miss one dose, or they might stop taking it without informing the healthcare provider. So which will eventually result in adverse drug effects and unnecessary health costs, because failure of the therapy will be resulting in some side effects, and if those side effects are not being reported or not being discussed with the healthcare provider, they will end up spending more on those health symptoms arised. And lastly, the major goal is to improve the quality of life of patients. So why medications are given or why treatment plan is done? As we know, treatment is done in order to ensure that the patient is satisfied in all the norms, that they will be able to do all their regular activities, as well as they will be able to do it in a happy or with a positive note, or with a positive behavior, or with a positive attitude. So that is why, to improvise quality of life, that an individual is overall satisfied with their life, including their physical health, their mental health, and as well as the social well-being. They are able to interact with their family, friends, and environment, anyone, in a positive way without any discomfort. That is the main aim, to improve the quality of life of patients. So what should be discussed, or what are the things which has to be said to any patient by a healthcare provider? After they come for a checkup, when during the medications being discussed, these are the things which should be discussed, as well as the information to be taken, that is medication's trade name, their generic name, common name, or any synonyms if the patient is aware of, as well as the healthcare provider should be explaining why that particular medicine is given, and its use, what is the benefit, what is the expected benefit. As you know, most of the medicines, it takes time to show its action. So you have to tell the approximate or expected benefit and the time or onset of action, and how you're supposed to take that medicine. Is it through oral route, that is through orally, or is it through parenteral solutions, or is it like topical application form? So what is the route of administration, and what is the dosage form also? So as you know, there are different types of dosage form: tablets, capsules, syrups. So what is the dosage form? And especially in case of special conditions like asthma, there are inhalers, there are nebulizers. So you have to explain even those administration in case of any special devices. And directions for preparing and using medications. This is done in case of any pediatric or any special population treatments, that is in case of antibiotics, which must be added with the water of injection to make it up as a syrup. So any specific directions to be given, that also should be included. And in case of missed dose, what are they supposed to do? If they fail to take one dose, what should be their action? And the other things, that is, as we mentioned, precautions. What are the precautions in case of any side effects they face, and some of the interactions that they might be experiencing with that particular medicine. So either it will be with the drug and drug, or either it will be drug with the food, or either with any other laboratory tests, or any kind of explanation required related to the interactions of that particular medicine should be included, and as well as the minor to adverse effects, if in case the treatment will be lasting for a longer time, it has to be said. And how you are supposed to store those medications and dispose in case of any contamination is seen, and should be discarded immediately. And rather than discarding it in your homes, it is better to approach the pharmacies or the healthcare providers, because they will be following the proper disposal procedures. And any information which is unique to an individual patient might be related to their health, or because of immunity compromised in that particular individual, or because of any disabilities they have. Moving on to what are the methods, or how you can do the patient counseling. So there are two types, that is, one is direct counseling and indirect, that would be distant counseling. So direct counseling, as you know, that is face-to-face counseling. It is interacting with the patient, and the counselor will be interacting sitting right next to each other or in a opposite way. So they have to give all the information and anything related to their therapy. So it will enhance the rapport, or as well as it will help in building up the relationship, as well as the patient will be able to explain things in a detailed manner. And then would be the distant counseling, that is through the phone. It is usually done in a very rare scenarios, as it will be utilized only for those patients who might not be able to visit the checkups or the clinics on a regular basis. So you might have to go via call or through video call. So that can be done in these scenarios. So it will be benefiting both the patient as well as the caregiver. So these are the two types of direct counseling, of patient counseling methods, that is direct counseling and distant counseling. So now, who are the major population or major category of patients whom we have to focus on regular basis? As we know, after you go for a checkup, doctor will be giving you a number of prescriptions, and that would be consulted at that moment, which is obvious. They'll be telling you when you're supposed to take it. Is it after food, before food, twice, thrice? All the information will be given during the consultations. In case if anybody else requires special considerations, these are the examples of those specific categories. The patients who are on long-term treatment, example epilepsy, hypertension, diabetes, and patients with diseases but without severe symptoms, prophylactic cases of tuberculosis, and patients using drugs with a narrow therapeutic index. As we know, most of the drugs, they have or they possess certain side effects, and these are the ones with the narrow therapeutic index, they are known, or there is a possibility that they might cause certain side effects. So that is why it has to be regularly monitored, as well as those particular patients should be consulted on regular terms. And then patients with the danger of abrupt stopping of treatments. So in these cases also, in case of any withdrawal symptoms are there, it should be accomplished. And patient with potential for non-compliance, abuse or misuse of drugs. As we mentioned, most of the times patients fail to complete the therapy, or they may not even take it on a regular basis. So that also should be considered. So treatment with the tranquilizers is an example. So as we have seen, what are the patient categories which we should be looking into in order to consult them on regular basis, and now we will discuss on what are the skills which should be adapted by a counselor while taking any patient counseling sessions. So as we know, in order to ensure that the counseling session is successful, you have to communicate. Whenever any counselor is meeting their client, they should be communicating in a well manner, so that all the issues related to their health is being addressed, and the same solutions are given by the counselor or the healthcare provider. So what are communication skills? There are two categories, that is verbal communication as well as non-verbal communications. So verbal communications can be based on language, tone, volume, speed. It can be written, either said addressed orally, or either it can be done in a written form. And another type is non-verbal communication. So body language. How is your body language? Whether you are showing interested, whether you are with a positive attitude you are approaching the patient, and the proximity, whether you are able to focus on the patient, the eye contact. When you talk to somebody, it is essential that you maintain the eye contact. If you don't, it feels the patient or the client will feel that you're not interested in the conversation. And the facial expressions, it should always be with a warm, welcoming attitude and a positive attitude. If you are maintaining that gesture, the patient will also be interested. They will not be hesitant to talk, and they feel that they can trust you. So these are the skills which under communication skills. And next, what are the other skills? So active listening. As you know, communication, if you are communicating with anyone, you have to listen to them. If you don't listen to them, they will not be communicating in a proper way. So listening to the client or the patient is essential. Whatever they are telling, you have to address to them. You have to ask any questions and what, where, how, what happened, all the questions, open-ended questions should be addressed there. And empathy. What do you mean by empathy? Empathy is something you are keeping yourself in place of that particular client or the patient. You are addressing them with their emotions. You feel what they are feeling. And clarity in explanations. So any explanations is given, it should be clearly addressed. It should be given in a local or a very simple language so that the patient is able to understand. So explanations should be given in both the ways. It should be explained in a clear language. And interpersonal skills, as I mentioned, building relationship with a patient by a healthcare professional is very important. So building rapport, it will help to address, or it will build up the trust so that even the patients will feel secure, they will feel that they are being understood, they are not being judged, and they will be, their problems or any issues related to your health is being addressed there. And as already mentioned, your body language. So whenever you address or whenever you meet people or whenever you meet a patient, you have to be with a positive attitude, with a warm welcoming gesture. And analytical skills. So assessing patient's understanding and their needs. So what is the issue with that patient? So for example, if I can tell, if a patient is not able to swallow any medicines because they are having any discomfort or pain while swallowing. So that can be addressed by either changing the therapy to the one which is whichever route they feel so, or their needs are being understood there. And addressing the barriers to adherence. So barriers, what is stopping them from taking those medications? So we will be discussing in detail about this. So what are barriers? As we mentioned, there are some factors which might be resulting in complete failure or complete stoppage of the medicine. So what are those? Let's discuss one by one. Patient related barriers. As you know, lack of understanding. So because of busy schedules or because of rush hours, sometimes the healthcare provider may not be able to discuss in complete detail, or it might be because the patient is not able to understand in that short duration of time. And yes, one more is illiteracy, as most of the individuals or most of the patients might not be well educated. And health literacy, either they might be having some kind of disabilities, either hearing issues would be there or vision issues would be there, so because of which they are not able to understand things or they are not able to recall. And then fear or anxiety about their condition, and any disabilities or language barrier. As you know, when you have to communicate, there should be a mutual connection, and that can be done by a mutual language, so that even the healthcare provider as well as the patient is comfortable to talk to. So it can be any local regional language. So and always if anybody is approaching them with a negative attitude, and the patients will not be able to address their issues. So next would be provider related barriers. As I mentioned, in most of the rush hours or during a busy schedules, during consultations, they will not be able to give proper details or incomplete details about their treatment. And sometimes might be because of lack of training in their counseling techniques. And what are the other barriers? That would be inadequate resources or support systems, and cultural differences affecting the communication. So that would be the barriers. And now let's talk about what kind of questions you have to be asking the patients while conducting a patient counseling session. So there are two types, open-ended as well as close-ended questions. So open-ended questions, these are the questions which does not end with the answer yes or no. It requires elaborative or very detailed descriptive sentences where the patient is able to explain in a more broader way. So that is open-ended questions. Whereas close-ended questions, it usually is answered as yes or no without any elaboration or brief response. So what is the purpose of open-ended questions? As it mentioned, the patient will be able to explain in a deeper, detailed manner and express all the feelings and emotions and issues related to their condition, and also it will help the counselor to respond respectively. And what about close-ended questions? It is the specific questions which are asked by the counselor in order to get a specified response. So what are the benefits? So in case of open-ended questions, they would be thinking in a detailed response would be received, and it will be able to analyze or formulate what should be the answer or what might be the reason for that particular symptom. And in case of close-ended questions, it is great for gathering fast input. For example, in case of any particular symptom to be identified, then they can be, or in order to diagnose one particular symptom. So everything has both have pros and cons. So this would be beneficial in order to ensure that open-ended questions would be for an elaborative approach, and close-ended questions are done in order to get a specified response. So now we have discussed what is patient counseling, what are the things or what are the factors which should be, why is it important for conducting a patient counseling, and what are the skills we have to be adapting, what are the barriers we have to be avoiding in case of patient counseling, and as well as what are the contents which has to be disclosed, and what is the difference between open-ended questions and close-ended questions. So now we will be discussing how you have to conduct a patient counseling. As you can see, these are the 4 steps: planning or preparation for the session, opening the session, conducting the session, closing or concluding the session. So planning for the session. So as you know, patients on regular basis, especially those category of patients who should be given special attention, especially for example that would be patients with a chronic condition like diabetes, hypertension, epilepsy. So these should be given a proper preparation should be done in order to counsel them in a proper manner. That is, for inpatient counseling, any information related to the patient should be gathered or can be gathered with the help of medical records, and for outpatients it can be obtained from hospital records. And what type of patient, whether you are counseling the child, or is it elderly, or is it mentally ill, or terminally ill patients. So every approach should be different depending upon the type of patient you are going to counsel. So the counselor should be adapting the level of understanding before beginning the session, and all the information should be gathered in a proper manner or an appropriate manner, and the approach to counseling will be done based on ages. If it is a child, you cannot be, you should be in a friendly way and in a joyful way, and you have to give them time so that they are they get until they get comfortable. It might not be even happening in one day, it might take even more sessions. So you have to be approaching each category in a different manner. So that is about the preparation or planning of the session, which is done prior to beginning of the session. Now you have gathered all the information, and now it is the time to start the patient counseling. So how you are supposed to do it? As you have seen, what are the skills? You have to be communicating, right? So you have to address or you have to introduce yourself in the beginning. You're going to address your name as if like, hello, my name is Fathima and I am your counselor for the day, and we will be discussing about your medications and your treatment plan for today. So, and then since you already know their background details, that is their medical records, and obviously you know their name. So if they are okay, you can call out them with their names so that they feel like they are being recognized or the counselor knows about them. So likewise, you can introduce and then you can ask to the patient to introduce themselves. So once the introduction is done, you can in detailed manner, you can tell what is the purpose of that counseling and what is the aim of counseling. So that is the starting the session. Now what are the things you have to do it throughout the session? So obtaining any information related to the drugs, that is allergies or any supplements if they are using. So most of the times what happens, patients fail to explain each and every aspect. They feel they would be hesitant or they would be not disclosing all the details, or they feel like the healthcare provider might judge them. So that shouldn't be happening. Being a patient or being an individual, you should ensure that all the detailed aspects or whatever you are doing it in your regular lifestyle, you should be putting it out in front of the counselor or a healthcare provider. So it be, if you are using any allopathic medications, you have to inform them what are the Ayurvedic medications or any herbal supplements if you are taking, or any dietary supplements if you are taking, or any other home remedies you are doing, or any other exercises you are doing, or any kind of information is there, it should be put up or it should be disclosed to the healthcare provider. And then assessing the patient's understanding of the reasons for their therapy. So now you know about their condition. Now you want to know what the patient knows about their condition. So you have to be asking in that manner that could you please explain me what you know about your therapy, or what do you know about this medicine, for what it is given. So you have to ask or assess the patient's understanding and why they are on that therapy. So assess any actual or any particular concerns which is faced by that particular patient. So now what is the reason why they are still continuing with that treatment, or why it is still not been resolved. So if any specific side effects or if any concern is there, that should be asked. And as I mentioned, language, it should be local language which as well as the patient and the counselor will be able to communicate in a comfortable way, and they'll be able to understand also. So use appropriate counseling aids, that is to present the facts, not just simply claiming about something. As you know, preparing for the session, you know what is the patient's condition, you know what are their medical records, you know what they are going through. So each and every aspect you have to do it in a detailed manner. You're going back and you're checking all the clinically approved datas which are updated and which are related to that particular patient. So that should be addressed, that you are going to spill the facts there and concepts in simple words rather than using some complicated terminologies. You have to tell or make them understand in a very simple way as addressed. For diabetes, you cannot just tell diabetes, you have to tell it in a local way. In case if it is Kannada, you will be telling it Sakkare Kaili, right? Because that is the local language which will be people would be understanding. So and it should be addressed in a logical order and also use open-ended questions. As we mentioned, what are open-ended questions? That is to address or to explain in a detailed manner. So that is about conducting the session. So that will be incorporating in a detailed information or communication between a healthcare provider as well as the patient, addressing all their issues and also communicating with open-ended and close-ended questions. So next, closing the session. Now you have carried this session. Now you know what is the issue, what they had faced, why they are still facing it, and what they understood about their treatment, what is their understanding. Now how you know what they remember, whether they remember anything or what they have understood, you have to confirm. So that would be done in this particular session. So verifying the patient's understanding by means of feedback. Now you have explained what are the required details to be given. Now you will be asking the patients what they have understood. So you will ask them to summarize all the required points which is being discussed in the session, so that you will be also understand what the information what you want to communicate, whether is it reached or not. So giving an opportunity to the patient to put forward any concerns, or if they didn't understand anything, they can ask the questions there, and helping the patient to plan follow-up. So as I mentioned, it will not just be done in one day. You require to do follow-up. You might take 1 month or even more than that sometimes. So showing gratitude for attending the session. So as you know, with a warm gesture, the how you welcome, you have to end your session in that manner, so that the patient will be continuing the treatment. Yes. So that is showing gratitude for attending the session. So that's all about the preparation, starting the session and conducting the session and concluding the session, that how you are performing a patient counseling. So now lastly, we will be discussing on the principles of patient counseling. So what are the aspects or what are the protocols which is being followed in certain scenarios. So as you can see, there are 5 categories: class, spikes, cones, buster and timer, and each protocol is used for specific reason. So class, a protocol for all medical interviews on a regular basis. And spikes, this is a protocol which is used to break any bad news to the patients or the family members related to their health condition. And cones, for discussing a medical error with your patients and family members. And buster, that is for challenging conversations with patients and family members. And timer is for effective communication in a short duration of time. Let's see one by one what is it. So class, as you know, it is used in all the settings for all medical interviews. So C stands for clarity, that is simple language to be used to explain the medical terms. Listening, as you know, it is the most important skill, active listening. It should be done in order to understand the patient's concerns. Acknowledgement, that is to validate, to give empathy or should show empathy towards the patient's feeling and what they have been experienced. And summarizing, now you are addressing or you are retelling what is being told by the patient. So key points discussed to ensure understanding. And then the lastly it is support, offer encouragement and resources for further assistance in order to continue or in order to ensure the treatment is successful. So what is an example? Here we will see, in a session with a diabetic patient, a healthcare provider might clarify the importance of blood sugar monitoring, that is clarity. You are clarifying why blood sugar monitoring is done in case of a diabetic patient, and listen to the patient's worries about managing their diet. So as you know, for a diabetic patient, management of diet is important, and acknowledge their fears and about their complications with the diabetes, and summarize the dietary changes discussed. So if any changes is done in their medication or in their diet, it should be summarized, and provide any educational materials like pamphlets on healthy eating, so that the patients will be referring back and doing as it is. So it can be in any local language. So that is one protocol. And the next protocol is spikes. So as you know, this protocol is being used to break any bad news to the patient or their family members. So what S stands for? Settings. As you know, patient counseling, it should be confidential. So when a healthcare provider conducts a patient counseling, it should be always done in a private and a confidential manner. It shouldn't be discussed with any other people unless that particular patient is referring to that particular healthcare provider. So ensuring a private and comfortable environment, that is especially in a closed environment, it would be very appropriate. And perception, to assess what the patients know about their condition. And then invitation, ask how much information the patient wants. Then knowledge, provide the information clearly and compassionately. Emotions, addressing emotional responses appropriately. If they are feeling sad or if they want to cry, you have to give them their moment and you have to understand their emotions. And strategy, so discussing next treatment options. What is the next steps? So that is for spikes, setting, perception, invitation, knowledge, emotion and strategy. So here you can see an example, that is when informing a patient about a cancer diagnosis, the clinician would create a calm environment, that is ensuring setting, that is calm, and private and confidentiality should be maintained. So the private space. So to gauge the patient's understanding of their symptoms, their perception should be considered, and ask if they want detailed information. You are asking them queries, so if they understood or they require any more information, and explain the diagnosis sensitively, what is been or what they are experiencing, that is knowledge, and acknowledge their emotions, that is for the emotions, and outline what are the treatment options which you should be doing it in the next step, that is for strategy. So next type of protocol which is being followed is CONES. So what is CONES stands for? C, that is to ensure messages are very clear. O stands for open-ended questions. So in case of any errors, you have to explain, and what are the informations to be, whatever information is to be given, it should be explained in a detailed manner. So that should be done by open-ended questions. And need assessment, identify what the patient's needs from the interaction, and empathy. So understanding the patient's feeling and supportive environment. So create a space where patient feels or they are able to express themselves in a detailed manner comfortably without any hesitancy or without any judgment. So that is for CONES. Clarity, open-ended questions, need assessment, empathy and the supportive environment. So let's see an example. A pharmacist might ask an open-ended question like, what concerns do you have about your medication? So that is one of an example of open-ended questions. And then you have to listen empathically to address their concerns while ensuring they feel supported throughout their treatment journey. And the last is, last but one is timer, that is time management. In order to, this particular category of protocol is used when there is, especially during rush hours or busy schedules, when they are not able to tell in a detailed manner. They will be providing information whichever is necessary. So allocate appropriate time for each session. Information gathering, that is collecting relevant information from the patient. Motivation assessment, understand what motivates the patient to adhere to the treatment. And educating, that is providing essential education tailored to that particular patient's needs, and to summarize the key points and schedule follow-up appointments. That is for the timer. Example we can see, in a busy clinic, a pharmacist might quickly assess what medications a patient is currently taking, that is information gathering, while managing time effectively to ensure all questions are addressed before concluding with a follow-up plan. And the lastly is Buster, that is B stands for build rapport, that is to establish trust with the patients. U stands for understanding their needs, to identifying the specific needs or concerns to the patients. Then S stands for supportive feedback, that is to get constructive feedback on their health management. And teach back, that is asking the patients to repeat back whatever information they have been understood, and encouraging questions, that is in case of any clarity that can be done, and providing additional resources for further learning. So what is an example? A pharmacist might build rapport by discussing common misconceptions about a medication, that is building rapport, and then ask the patients what they know about it, so understanding their needs, and followed by confirming their understanding through teach back methods. So asking the patients to explain all the key points to make yourself understand what is their understanding related to their treatment or their condition. So yes, so that's all about the patient counseling. We have discussed all the concepts related to patient counseling and what are the essential concepts under it. So patient, as you know, patient counseling, it enhances the understanding on the treatment and building trust for an effective communication from both the ends, that is for a healthcare provider as well as the patient, to promote adherence to the treatment, that is the patient will be able to complete the treatment. It can be an antibiotic course or any other treatment plans, and addressing the emotional needs, and facilitate behavioral changes, if any behavioral changes. Earlier they might not be complying to the therapy, but now they would be complying, and also a positive attitude towards life and and towards anything, any of their lifestyle decisions, and then ensuring the safety of the patients. So these are the concepts which we have been discussed. So that is all about the patient counseling. These are the references which have been used, and thank you, and I hope you all understood what is patient counseling.